Okay. Yeah, I think we have started. Okay. Good afternoon, everybody. Welcome to Biomanasa Sanjeevani's sixth series of our webinar. So, myself, I'm Gina. I am a project coordinator of Biomanasa Sanjeevani. So, today's program is about hearing loss in elderly, whether it will lead to a dementia. So, to talk about this topic, we have Dr. Pradeep. He's assistant professor and speech pathology and audiology from NIMHANS. On to you, sir. Thank you.
Yeah, I will open the PPT.
Yes.
Okay. Good afternoon, everyone. It's indeed a topic which has always been close to us. We have been discussing on this topic for quite some time with respect to hearing loss in elderly. Can it lead to dementia? Can it not lead to dementia? And there has always been a lot of argument on this. So today I thought, okay, whatever we know, we will shed some light into it and bring in some information to see if we can understand whether hearing loss leads to dementia in elderly specifically. And I'll be very precise to the point. I will keep it as simple as possible. I will not get into the anatomy, physiology, pathophysiology, and all the technical nitty-gritties, which definitely is not something need of the hour, which not the person on the other side would like to know. But hearing loss per se, what are the causes which, because of hearing loss, might lead to dementia is what we are going to understand. So I'll start with two important quotes. I've always been fascinated by these two important quotes whenever I read them. And when Helen Keller told blindness separates people from things and deafness separates people from people, this is something which is really fascinating to come from a person who had both blindness and hearing impairment, right? So blindness is something, I mean, even that's a severe disability. I would not compare one disability with the other, but a disability detaching a person from another person is going to be a more severe disability than detaching you from a thing. So hearing has something which has been ignored for quite some time. People take it for granted. Those spectacles have become a fashion statement. Hearing aids are still finding it difficult to reach. People see us forget fashion statement. I'm telling they're finding it difficult to reach the place where they're supposed to be. They're still lying on the benches and desks and other places, right? That's one. And the second most important thing, especially in elderly, is communication. How we communicate to them, how they reciprocate, and how there is a dialogue. If there's no dialogue and if they are not able to reciprocate to what you say, there's always a communication breakdown. And as Peter once mentioned, the most important thing in communication is to hear what isn't being said. And to hear what isn't being said, you need to hear first. Only when you hear and only when you understand what is being said to you, then you will hear what is that is not being said or what is that you need to interpret. And if this barrier is there or if this breakdown is there, your communication is not going to be effective. And these two issues, a communication barrier and an uncorrected hearing loss, can have a long-standing devastating issues on the mental health per se, which we have been seeing in a lot of patients, which has been established over the years in the research also. You can find a lot of research saying where hearing loss basically leads to kind of mental depressions or social isolation, which in turn are being much more severe. And all these things are something which is because the hearing loss was not treated, one, the hearing loss was not identified, two, three, and the most important, it was taken for granted and it was never accepted. Hearing loss, yes, my mother had, my grandmother had, my grandfather had. At 80 years, if I don't hear, it doesn't matter really. Really? So at 80 years, if you cannot read, don't you go for spectacles? At 80 years, when you cannot walk, don't you seek help of a walking stick? So when all those things have find priority in life, hearing has never find priority in life until and unless someone really feels that yes, hearing is important to me. Generally, hearing has been ignored for quite some time. And what we really need to know, or what exactly I would try to tell you is, do you call it hearing loss a disability, or is it something that everyone has and I have little more? Or when do we call something a hearing loss? This has been a question which I have been asked by many people, and they say after certain age, yes, I can't hear because I can't walk as fast I used to earlier. I can't see things clearly the way I used to see earlier, and I can't hear things the way I used to use earlier. So it is something related to my aging. But when do I call it a hearing loss? Or what is that something which can tell me an hearing loss? So how do you find out if you have a hearing loss, right? Do you need a sophisticated equipment or a sophisticated lab? You need to go to an audiologist, get yourself tested, get the audiometric results and bring back the results, get an audiogram evaluated by the audiologist, and they tell you the severity of the hearing aid. Is that the way to diagnose hearing loss? I mean, that is not a possibility at all. And these possibilities in India at least comes only in the severe stage, and no one in the milder degree or milder stage is going to a professional consultation. So what is that which will tell you whether you have a hearing loss? What is the answer? So what is the answer? Yes, what is the answer? This four-letter word, what, is a diagnostic tool, if I would say, for you people at age of 60, 70, whatever age when we call a geriatric population, or in fact, I say this even for a younger generation. If you are asking someone repeatedly, what is it that you said? What did you mention? What is that you meant? I did not understand. Or anything to do with repetition with the word what. Here, the word is in English. It can be in any language. The word what, if told beyond certain times, and if it is going over someone's head, then definitely you should start suspecting yourself to have a hearing impairment. It could be anything, but definitely there is some issue in your communication, right? That's what I'm saying to say. There's definitely some issue in the communication, and that particular issue could be hearing loss. And if you are asking for repetition, and if the word what keeps coming up, it is 80% of the time, or I would rather say 90% of the time, that is going to be hearing impairment, hearing loss. It could, excuse me, it could be of any degree. Let it be mild, let it be moderate, and of course, severe degree. This is not the way to see it. Severe degree people will report it in a different way. But the unnoticed or the missed population or the missed individuals where they also do not come forward, or we also sometimes miss, is this milder degree or mild to moderate degree hearing loss individuals. For them, the word what should be a diagnostic tool. This can be used for self-assessment by the individual or the family members who are with the individual. If the patient is asking for repeated information, or if he's repeatedly asking what, then 90% of the time you should suspect he has hearing loss, and definitely it is time for you to get him evaluated, probably a detailed evaluation. So this is to know how to diagnose your hearing by yourself, and for family members to see if your near ones and dear ones really have hearing impairment. And this one simple four-letter word, I would say, is a gold standard for you to suspect hearing loss in individuals. Now, coming to the second point, I have always been asked by elderly people, why should others say I have a hearing loss? Can others say I have a hearing loss? And if we can read this sentence, I think so, others are the people who will say you have a hearing loss. The wife says, I think you need a hearing test. And the husband says, why the heck do I need a hairy chest? So, of course, it is others who would say you have a hearing loss because you are not hearing what the other person is saying. Until and unless you don't want to hear, that's a different story altogether. But most of the time, elderly should accept that if someone says you have a hearing loss, and if you try to misinterpret what is being said, then 90% of the time, the people around you are the ones who is going to identify the hearing impairment in you. And they are the people who would be able to really tell you what exactly is happening with your hearing system. Sometimes, if they speak softly, you might not hear. Sometimes, if they are very fast, you might not hear. PPT is on, it's not showing here. I'm sorry. to go back from the beginning, I'll show. Yeah, these two. Sorry, I mean, I missed the PPT. Thank you, Sister. I missed the PPT, or I did not share the screen. And these are the two important quotes I told you. One is from Helen Keller. The other one is from Peter Drucker. And the second one is this question, or what. As I mentioned, what here, the 4-letter word. This is what is going to really describe if you really have a hearing loss. What 4-letter word do you folks hearing loss use most? And the person says what, right? And as I was showing you, this is the slide, I think, which we were speaking. I'll start with this slide again. So can others say you have hearing impairment? Yes, 90% of the time, it is others who would identify an hearing impairment to you. And I would put even the family members in the others category. In the sense, anything which you don't report, which is told by someone else, would get into the others category. And if you say anything about someone and if the person is not able to really understand what you're saying, and in that case, the person would try to misinterpret whatever has been said. And that's how generally most of the time the hearing loss gets detected. And finally, what happens to the family members, or what is that your family members get to hear, right? If you see this picture, it's not moving. Yeah. If you see this, I mean, these are some of the slides to make the presentation a little more fun-filled. But if you see the contents are not really, which are to be lightly taken. The specialist gave him a eardrop and asked him to have it in his ear twice a day. And the patient heard, have it in the beer twice a day. And the letter E is replaced by B, but the consequences of that is totally different, right? So finally, tomorrow the doctors might be blamed, of course, telling that we had asked someone to have the drops in the beer for hearing impairment. Well, that's just to make you laugh, but this is what happens. Even one letter, if you miss, the whole conversation or the whole scenario or the complete picture of what was told to you will be mistaken. And as long as it is not something which affects you, it's fine. But there are at times statements where it can really, at times where there are statements which can really affect you to a severe degree. And that is something which we need to really avoid, and which is something we can avoid. And if there is something which we can avoid, we should look into it rather than waiting for some consequences to happen. So these are some of the things which I wanted to bring it to your notice. One is, how do you identify a hearing impairment by yourself? One letter what? If it is frequently repeated, please make sure that you get your hearing evaluation done. Second is, can others identify hearing loss? Listen to others. 90% of the time, others would tell you if there is an hearing loss, and you should listen to them. Third, you should start using hearing aid, because any sentences which is misunderstood can have a very bad impact on your total conversation, your understanding, and your processing of the information. As shown in this slide, as long as it is in the beer, it is fine, but it could be anything. I mean, this is just to make it more fun, but this has happened with many people, and many people have misunderstood words, and most of the time it is they presume or they assume that that's going to be a rhyming word. And when they hear only half thing, what they tend to do is they tend to fill the rest half of the sentence. For example, if you ask me what is your, most of the times I would fill it with name, right? But it could be what is your age, it could be anything, but you presume that it is name because 90% of the time it is said that way. So they tend to fill the information. To avoid filling information, to avoid misunderstanding words, to avoid hearing or substituting a rhyming word, it is always better to accept your hearing loss. And acceptance is the first treatment, and acceptance is the first line of intervention, I would say. Now, what happens if the hearing loss is long-standing or untreated? Now, when we say there are three major issues which happens because of hearing loss. One is you cannot hear in a group, as I have shown in the picture here. If there are multiple people speaking to you, if there are more than 10 to 15 people speaking in a group, and you want to speak to someone, because of the background noise, the brain is not able to get enough information. Basically, the brain is aged, one. Second, the auditory system has lost its complete capacity. It is working only at some minimal capacity, or at least 25 to 30% reduction in its working capacity. So all the functions where it has to segregate the noise and it has to enhance the signal and it has to give to the brain, that particular function is not happening. And excuse me, because of which definitely you will not be able to hear in a noisy environment. Okay, this is the first thing. Second thing, the most important one, or most important behavior in elderly people because of hearing losses, they always prefer one-to-one communication and in a silent environment, and they tend to come and sit near the other person, which is okay with the family member, but which is not ideally something which you can expect when you go outside. Once you're outside the house, you cannot expect to have a one-to-one conversation everywhere and presence of a silence background, which is not a possibility, ideally speaking. Even at home, I don't think so you will get a complete silence environment. As long as there are kids, there's a family somewhere close to the main road, there's always noise. So ideally speaking, there is no silent environment until and unless you sit in a sound treated chamber, the way I'm sitting now and speaking. It is very rare and it's very difficult, and it is very depressing to have a very silent environment, right? So these two. And the third and the most important thing is isolation. What happens, individuals eventually what they do is they tend to isolate themselves. Initially they will not accept, no, 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 I'm fine, I'm doing all good, you don't worry, you people have the conversation, I'll just sit and do my other work. That is the beginning of your isolation. In the sense, you are doing it because you are either not able to follow the conversation, you are not able to keep up with the speed of their conversation, you are not able to grasp complete information what is told in the conversation, and probably you are not able to engage yourself in communication, most importantly because you are not able to recall what was told a minute ago from your auditory system. And when they ask, didn't I mention you 2 minutes back, you start feeling insulted, or you start feeling someone is pricking you, and or someone is pointing out to tell you that you have an hearing impairment. You start isolating, you tend to withdraw from the conversation, tend to divert your attention, and slowly this isolation is what is one of the major risk factors for all other diseases to come. It's not something to do with the physical disease like diabetes or hypertension or any of those things, but all your mental disease, from depression to dementia, name it. I will not get into that, but any of those things which you are getting is because of the isolation. So now from here, I will take you why we say that people with hearing impairment are at risk of dementia is this isolation. Forget about all the other factors. All those factors will lead you to isolation. So this isolation is what will take you from where you are to at-risk category for patients with dementia. So for example, I will say one group is normal, one group is dementic, or one group is at risk. So I will not tell you would be dementic. No, I will not post that statement. I will not say that. But you would be in the category of people at risk for dementia. So other than all other factors relating to hearing impairment, like I'm not able to hear, I'm not able to hear in the noise, the voice is not clear. If they speak fast, I can't understand, and the speech is degraded. These are some of the complaints related to your hearing. Because of that, when you go into social isolation, one major risk factor is your cognition decline, which is one of the risk factors associated with dementia. And this cognition decline is very simple. If you don't use something, your brain is going to forget it. If you don't speak a language for say 20-25 years, you cannot be as fluent as you were earlier. If you don't use your hand for a very long time, of course there is some kind of muscle atrophy or muscle wasting, something which is going to happen. Similarly, if the hearing system is not able to give the information to the brain, and sufficient information, I'm not telling only information, the sufficient information to the brain, then what happens is the brain will start losing its ability to process the stimulus and understand the stimulus and give you a feedback. And because of which your cognition, by cognition, simple things, your ability to think, your ability to recall what has been told, your auditory memory, immediate recall, all of these things will get affected, right? One simple example may be your family member is saying, just go get that vegetable and come and give it to someone. So you remember only go and get the vegetable and you forget, because forget that second part of the sentence, go give it to someone. So you go get the vegetable and you come back and you are not able to remember what was told because your auditory memory is getting affected, because your system is getting less information and the system is not getting the information which it was supposed to get. So the cognition has been branded, or the cognition is one of the major factors or decline, cognition decline, in fact, not exactly the cognition decline associated with hearing loss is one major risk factor which is associated with dementia. Now, what happens? The brain gets strained when you start giving less information. This is simple logic, like the bandwidth of the information. Now, when you say you have a mobile with you, you have a SIM card. If there is no enough bandwidth, though your mobile is good, your SIM card is good, you are in the center of the city, you would not be able to hear the speech what is spoken on the phone, right? After some time, what you tend to do is either throw the phone away or disconnect the SIM card, and definitely you would really strain yourself to hear what is told when there is low bandwidth. This is the same logic which would be applicable for your brain. When the information is going correctly, as long as the total information which is delivered to your system reaches the ear, it is fine. But if the information starts getting degraded, if the information is not reaching your brain, any barrier in between the brain and the information is going to make the brain strain itself, put in more pressure to understand what is being said, and eventually, just like how you would throw the phone, after sometimes your brain would stop responding, or it would gradually start reducing its information processing ability. And there are imaging studies which even tell that after onset of hearing loss, the other areas around that area start picking up the signal, and once that starts responding, it doesn't give the enough information for you to run the motor. For example, you are sitting in a park and suddenly you hear a lion roaring behind you. Do you just turn around and say, okay, oh yeah, lion has come? No. What has to happen? You have to get up, you have to run. There is a reflex which has to come. And for that, your brain need to process. So this information, when you have hearing impairment, and if the lion is roaring at 90 dB and if you're hearing only 25 dB, will you run? No, because the brain will not give you the information. This is one simple example I'm giving you in a danger situation. But generalize it to a normal conversation, generalize it to hearing a sound, generalize it to playing with your grandchildren. Slowly your grandchildren might withdraw because you're not understanding what they say. Your son might not be able to sit with you for a long time because you're not able to pay attention to what he says. So all these things are related to the reduction of information going to the brain, and which will stimulate your cognitive decline. Now, the second point I already discussed, the lack of stimulation and the brain cells start shrinking. Third, which I just told you earlier, again, social isolation comes into picture here. The more you're isolating yourself, the lesser is the cognitive functioning there. For example, when I sit alone, I don't have to think. I don't have to process an information. I don't have to interact with someone. I don't have to hear someone speak to me, and I don't have to answer someone. So basically what I'm doing is I'm doing nothing. I'm just sitting idle, and all that my brain has to do is the basic functions just to keep me active. But when you do that, what happens is slowly what happens is the social isolation will trigger a cognitive decline in you, and that cognitive decline will start isolating you more in terms of hearing, in terms of interaction, even when you want to go outside. So again and again, this cognitive decline is something which is really putting more pressure on the brain and pushing you into the at risk for dementia category. And more listening efforts, again, as I said, Your cognition has to put in more effort. The cognition reverse has to work. And if you fail to recall what is said, it is going to impact your memory. If I say a sentence and after 2 minutes, if you're not able to tell that sentence, definitely I will not be interested in having the conversation. Though, if you keep asking for repetition, and probably I would stop the conversation and you would feel dejected. Now, if you can see that picture where a boy is walking with his crutches, it is just to make you understand in a simple term. Now, if he has to cross the crowd, how difficult will it be for that boy or that man to cross that crowd with that crutches? It is going to be almost next to impossible, or he has to really, really struggle and strain himself, right? On the other hand, if the person was normal, he could either push them to the side or he could find some ways to reach the other side of the crowd. This is the same thing if you consider that man to be a signal with hearing impairment, and if the other end of the crowd is your brain, definitely the information will find it very difficult to reach your brain. And on the way while reaching, he might brush people, he might fall twice, he might get up, he might be tired, he might take 15 minutes to reach where a normal person is taking only 2 minutes to reach. Same thing when the information is told, what is your name? You might hear only 10% of that what is told to you. Plus, I mean, this is just an example, don't take it literally. Only 10% of the information, for the information to reach your brain, it might really take 5 minutes, and for your brain to process another 5 minutes, where you become really, really slow, right? So this is one basic example or one simple way to understand. So any uncorrected hearing loss is going to put you into social isolation, cognitive decline, and more importantly, staying away from your routine work, which again would impact your brain functioning. So these things put together, which is consequence of a hearing loss, will put you into people at risk for dementia. Now, finally, as I said, I'll be very brief. For individuals, for example, for individuals, what we need to do is individuals, I mean, all our elderly people, please get yourself assessed early. When you yourself suspect that something is wrong, when you feel that you're not really able to hear something which is said, don't take it for granted that, yeah, I'm aged, it's part of my aging. Definitely it is part of your aging, but if it is something treatable, correctable, please make sure that it is not ignored. And if someone says you have a hearing loss, don't get offended. Yeah, I know I have hearing loss. You don't have to point out and tell me. I know I have hearing loss. My father had hearing loss. My mother had hearing loss. They never wore hearing aid. They lived for 95 years, 90 years. Those days are different. The present days are different. You never lived the way your father lived, and I can't live the way my father lived, and my child will not live the way I lived, right? There's a saying, by the time you realize your father was a hero, you'll have a son who thinks his father is a fool. So it's always foolishness to compare ourselves with others. Always compare yourself with the previous generation. Things have changed, times have changed, and the medical field has changed. The availability of resources has changed. Everything is changing. So you also change with time. And if someone in your family says, please listen to them, and you can request them to take you for an hearing evaluation. Do not hesitate to use hearing aids. Again, that is one hesitation I have seen even in people who are 80 years, 85 years. They say, it's okay, sir, bada bidi, adenakke. Why should we really get into the hearing aids? So do not hesitate to use hearing aids. And most importantly, do not compare your problem with others. This is something which would irritate your children, your family members, your near ones, and your dear ones. Not that you don't compare yourself with others, but the way you say, he also had hearing loss, you mean he will become dementic? My uncle had hearing loss, will I become dementic? There is no point in asking such questions. There's no point in comparing yourself with someone else, which is not the way to do. And my humble request is, make hearing aids a old age fashion statement. The way spectacles have become a fashion statement, it's in your hands. Wear hearing aids, be open about it. I can't hear, I'm wearing a hearing aid and I'm happy with it. The family members, please have patience for the family members. And most importantly, and more importantly to the family members, do not hesitate to convey them that they have hearing loss. Tomorrow you would be held responsible, even if not 100%, at least 50%, because yeah, my dad doesn't listen to me, my mom doesn't listen to me, or my uncle really he doesn't like me telling all those things. So this kind of attitude or this kind of approach towards the hearing impairment is not good. Yes, of course, they are elder to you, they are aged, they might have a really difficult time to accept their disability. And it is not only the hearing, they have multiple things. Their walking is slow, their eating is slow, they're dependent on you. Probably with that concern also they might say, well, I don't want to be a burden to you by adding my hearing impairment also, financially, emotionally. So be patient with them and do not hesitate to convey them whenever you feel that they really have a hearing impairment. Make sure the information is conveyed rather than hiding it and you compensating for it. You will start speaking louder, you will start speaking slower, which again will make them feel that they don't have a hearing loss. So you have a normal conversation. Of course, I'm saying you have to speak slow, you have to reduce your rate of speech. All those things are strategies with hearing aids, not without hearing aids. Don't use the strategies without hearing aids. Use those strategies with hearing aids. Learn is yeah, and seek guidance from the audiologist whenever, whatever information or in whatever degree or whatever level you want information. Please seek information from the audiologist regarding the hearing aid, the usage of hearing aid, what kind of hearing aid should you give, and how long in a day should they use a hearing aid, or any of those information. Seek that information. And why I'm telling that is, an audiologist in the clinic may not be able to convey all this information to an person who is 70 years or 80 years old, or we may not be able to make them understand. So you seek the guidance from them and you take the responsibility of uh, making this one. And finally, before I wind up, I'll tell you a small story about this tortoise and hare, which I recently heard from my Professor Rangasai, and I slightly modify it for today's presentation. And the tortoise and the hare story, as you all know, once when the tortoise won the race, the hare won the race once, and the tortoise lost the race. They went to a common friend and they discussed, and the friend told them, it is not the race which made you lose, it is the path which you take that made you lose, right? So then the friend gave them a suggestion telling that you divide your path and make 50% surface and 50% water and see who wins. And of course, the hare reached the water and it couldn't cross. Tortoise, though it reached slow, it crossed, and tortoise won the race. They again went back to the friend, and the friend said, this is not the right approach, and both of you do it together, approach together. And the hare carried the tortoise until water, and the tortoise carried the hare until the surface to reach the other side. And they both won the race. So let's walk together and don't confuse whether hearing loss leads to dementia or dementia leads to hearing loss. There are people with hearing impairment who are not dementic. There are people with dementia who do not have hearing loss. But having said that, we have been seeing that there are large number of people who are at risk for dementia, and the cognitive decline is 200% related to your hearing impairment. That has been well established, and cognitive decline is a major risk factor for dementia, and that's how we are relating one to one. And there are positive emerging results telling that there are high chances or there's one-to-one relation between hearing loss and dementia. So the whole summary of the story is hearing impairment as such will lead to cognition decline and social isolation, which are the two major risk factors for dementia. And therefore, we are relating hearing impairment to dementia and treating them together at a time. Whenever it is noticed, if it is hearing impairment first, treat the hearing impairment. If it is cognitive impairment, please monitor them for their hearing. Don't mistake a hearing loss for a cognitive impairment. alone when you see cognitive impairment first. So all hand in hand, I think it would be a great walk together. With that, I think I'm on time. Thank you.
Thank you so much, sir. Thank you for this wonderful session with us, sir.
So as a panelist, I can come in now?
Yes, sir.
Okay, thank you. First of all, I would like to thank Dr. Pradeep for such a wonderful presentation. It was very clear and it is very black and white so that we don't have a confusion. It was very strong. We have some interesting queries in the chat box, and also we have some queries from otherwise elderly people then and when we encountered with. So I'd start with the chat. First was a question from Dr. Sahai Raj. I think the question supposed to be like if there is any psychotic symptoms or if it's dementia, how would you evaluate them? How hearing loss can be evaluated in the patient with in a difficult to test population? I think that's the query, sir.
Yeah, thank you, sir. Well, we have a very established way of evaluating hearing impairment. I think that's there across all the clinics and all the institutes currently. We have something called auditory brainstem responses, where we don't require the patient to be cooperative for hearing evaluation. So once we have a rough estimate during our conversation or how the patient responds to non-verbal sounds, generally from there we get an idea of what exactly could be or what exactly might be the hearing impairment, and from there we generally do the electrophysiological test results, which would fairly, almost, I would not say 100%, but almost 90% of the time it would give you the exact thresholds from where you can take it further with hearing aid fitting or any of those things what you want.
That's a related question to that. Is there anything that they should be prepared if they come for a test? Like, for example, when they go for an MRI, they should go with the particular things ready. So is there anything like that? Because we are dealing with elderly people. Is there any special things?
Yeah, I think that's a wonderful question. Generally, what we do is when we are doing any of this electrophysiological test, we generally tell them for some amount of sleep deprivation, because the patient has to lie down quietly. And it's very difficult if the patient is distracted. We have seen patients just pulling and throwing the electrodes. Those things have happened. And there is no oil on the head. These are some of the basic instructions for the electrophysiological test as such. But other than that, the sedation and other things are something which we take it only in the extreme situations, which is not regularly done, which we generally don't prefer, at least at NIMHANS, to do the evaluation under any kind of sedation until and unless it is need of the hour, it is something which is really important. But yes, there are some basic precautions for them to take when they come for electrophysiological test, which we would convey them. And one of the most important thing is oil-free head, have a shampoo bath, and they have to sleep at least for an hour or something. So mild sleep deprivation is something which is suggested.
Is the test very invasive, or they should be afraid of? Because
No,
when
no,
the
no, no.
electrophysiological test,
Yeah.
they may not. Yeah.
No, none of the tests are invasive in us. In the sense, what we do here at least is not invasive. All electrodes are surface electrodes. We just clean and place it on the forehead and your mastoids, and the stimulus is given and we record. There's no invasive test at all.
Thank you. The next question is from Ms. Lakshmi Prabha. It's any drug-related hearing loss in elderly people?
Yes, there are two ways of looking at it. Now, one is drug-related hearing loss. The second one is why the drug is taken. The reason you are taking a drug itself might be a cause for hearing impairment. For example, if you say hypertension, if you say diabetes, any kind of vascular disease is almost 70 to 80% of this time seen to induce a hearing impairment. So it is not like the drug alone is causing hearing impairment. But of course, yes, we have seen the cancer-related drugs, especially the oncology drugs, to induce drug-induced hearing impairment. But my clinical observation, a pure drug-induced hearing impairment in an elderly is very rare. In the sense, if he is 70 years or 80 years old, definitely age-related hearing loss or a presbycusis component or a sensory neural component will be there. And your drug-related hearing loss will be an added factor, or it would increase the risk of deterioration. But in isolation, it is very rare. But the treatment is, of course, same. Once the evaluation is done, If it has to be corrected with hearing aids, that is the line of treatment.
The next question again from Ms. Lakshmi Prabha. It's about does elderly hearing loss comes under PWD Act? And what is the cognitive load? I think two questions in the same question. One is whether it comes under Person with Disability Act. Second is what is the cognitive load of hearing loss? That's what I think.
All hearing impairment is covered with Persons with Disability Act. There is no age restriction. Anyone who has hearing loss from birth till death can claim all the benefits by Government of India, especially the monetary benefits like monthly pensions, the bus passes, the concession railway tickets, and all. Anyway, I'll not name many. Just to name a few, they can get all the benefits. Yes. And job restrictions, that depends on the organization which is asking for a specific kind of a requirement. So I'm not very aware of what age is the cutoff for job reservation to answer the first one. But monetary benefits, yes. The concessions, yes. The railway pass, bus pass, yes. And the hospital benefits, the income tax benefits, elderly people who have hearing loss, certified hearing impairment, they have income tax exemption. So there are various schemes or various facilities or benefits which has been extended to hearing impaired across lifespan. Cognitive load, again, it depends on two important factors. One is the degree of hearing impairment. The degree of hearing impairment will really have a serious impact on the cognitive load. Now, for example, if the patient has moderate hearing loss and if it is uncorrected, his cognitive decline will be much more than someone who has a mild hearing loss. But the rider here is a person who has moderate hearing loss will come to me earlier, and I would be able to diagnose him much earlier than he gets into a cognition decline mode. But a person who has mild hearing loss will come to me very, very late, or until and unless someone really convince him, he will not turn out to the clinic. And that is why they are at more risk. And generally, moderate hearing loss people, if the hearing loss, generally their hearing loss at least 70% of the time, if not they agree, the family members will force them and bring. The mild hearing loss category are the people who generally get missed and who are at more risk.
Also, I think the related questions is like the cognitive expenditure. Like if you have a hearing loss, the amount of attention, the other things that you put in to understand certain things does it vary with the degree of hearing loss? I think that also would mean, I think.
Yes, as you said, definitely the attention and the whatever cognitive abilities you mention it will vary with degree of hearing loss. It is directly related to the degree of hearing loss. It is not that the mild loss will have the same deficits as a moderate, and a moderate will have as the same as profound. That is not acceptable. It has one-to-one relation until and unless hearing loss alone is the factor without any other underlying factors.
Thank you. I think Ms. Lakshmi Prabha is quite active with a lot of questions. The next question is from Ms. Lakshmi Prabha. Some of the hearing loss can't be managed with hearing aid also. Is it true, sir?
Well, partly true and partly not true. It depends on your evaluation. Now, to be very fair, the basic hearing test alone will not determine the benefits that an elderly person is going to avail. So what you really need to do is you have to find out his realistic speech perception scores. One is that. The second one is you need to understand how his speech is perceived in the presence of a background noise. That is what is going to be his real situation where he's going to use the hearing aid, right? So without evaluating this, if you are just giving an hearing aid, that is when people tend to say that they are not benefiting from hearing aids. This is one. Second reason why senior citizens say that they don't benefit from hearing aids is wrong fitting. The wrong fitting, I mean, without getting tested. There would be a neighbor or his friend's father who was using, he passed away, get that hearing aid, you start wearing that hearing aid. These are some of the wrong practices. And thirdly, going and buying it in a market without getting tested. Hearing aid cannot be brought and worn. Hearing aid is, it is not like I give you a lorry and ask you to drive and you don't know driving. It is similar to that. So you need to get yourself tested, and the hearing aid has to be programmed for your hearing loss. Only then you would benefit from hearing aids. This is one reason why senior citizens say they do not benefit from hearing aids. The second reason, as you said, there is one particular group which really does not benefit from hearing aids because of the aging and the uncorrected hearing loss for a longer duration. The brain has lost its ability to understand the speech, though there might be retained ability to hear. When you put the person with on a hearing aid, he might say, I can hear but I'm not able to understand, which is there. And that particular group, you cannot treat that with any hearing aids of even a lakh or 2 lakhs or 3 lakhs. It might increase by 1% or 2, which really doesn't matter. Those people with hearing aids, you need to use the certain strategies, which again we would be able to counsel you based on the person's ability to understand, how much of speech understanding is retained. So partly true, there is one group which really does not benefit because of their brain losing the ability. And that is the reason I say, when you detect a hearing loss and when we request you to start using the hearing aid, start using the hearing aid immediately. It is not life threatening. It is not like a cardiac problem. Today you don't use, tomorrow we will be bedridden or we might pass away. But what happens is 2 months, 3 months, 4 months, 6 months, the each passing day, the ability for the brain to react to a aided stimulus starts reducing. That's when you really have a problem.
Next is a question from Professor Sivashankar. Can senior citizen go for cochlear implants? Where two questions: where should senior citizen go seeking help for hearing test? So there are two parts. First is cochlear implant and where they should be going.
Senior citizens, there are almost all clinics around Bangalore. My humble request would be, please go to a qualified audiologist, any audiologist. There are 4 to 5 institutes in the Bangalore. NIMHANS has a full-fledged department. We have a dedicated speech and hearing clinic for senior citizens. So getting evaluated by an audiologist is what I would suggest. And the second question, I think sir has put me in a trick by asking whether senior citizens can go for cochlear implants. Well, in India, we have still not gone to that level of advising a 70-year, 80-year or 60-year-old to go for a cochlear implant. But there are cases abroad where people above 60 who do not benefit from hearing aids have gone for cochlear implants. But again, it depends on the individual's financial capacity, the individual's requirement, which if he is completely deaf and postlingual deaf, what I mean by deaf or he's completely lost his hearing is postlingual. Maybe he's 60 years, by 65, he lost his hearing completely and he was a person who was very active and he's medically fit and financially able to afford, then it should not be a problem. I don't see a problem in that.
Yeah, and next question is, I think, from Sudha Hariharan. Sudha Hariharan. She says she is having a sensorineural, bilateral sensorineural hearing loss. The ask is it curable by operation or by any other method except a hearing aid? I think she may not be happy with it.
Sensorineural hearing loss by itself means there is issues with your sensory system, which is your cochlea and your neural system, right? That's why it's called sensory plus neural. Your sensory system is the cochlea, the inner ear, and the neural system is your auditory nerve. Surgical intervention to treat that is just what I answered, is your cochlear implant. And that cochlear implant, I would suggest only if you're not benefiting from hearing aid. Other than this surgical intervention, if you're looking for any kind of surgical intervention, the way they do for ear discharge, they do for some kind of malfunctioning in the middle ear, and with medication, can it be corrected? It is not at all possible. Once you have been diagnosed as sensorineural, then the only solution for you is to go for a hearing aid. And I would suggest, please go for bilateral hearing aids. Again, don't go for a unilateral hearing aid.
Is it also related to how much to expect from a hearing aid, Dr. Pradeep?
Expectation depends on multiple factors, but to broadly classify, one is your age. The second one is how long have you not been using hearing aid since the onset of hearing loss, which according to me is one of the most primary factor which will determine the outcome of the hearing aids for an individual. Third, the degree of hearing loss, of course, yes, it makes a lot of difference. But nowadays, I mean, you just have to pay little bit more than what it was in those days. But there are hearing aids which have come out to address even 90 dB, 100 dB hearing loss, and it really works as efficiently as a hearing aid which works for 30 dB. So the major factors here are the long-standing untreated hearing loss. The second one is the speech perception ability retained, and third one would be degree of hearing loss, and the last one would be your age.
Yeah, thank you. Those are the factors, and sometimes people do feel that when I wear a hearing aid, I'm going to get my hearing back to the normal days as usual. Is there something that you would like to tell regarding what to also expect from a hearing aid?
There's always something. You have to be realistic. There's nothing which can replace your original system, whether it is hearing, walking, vision, or anything. It is always an aid. And secondly, most importantly, don't compare your hearing aid with a spectacle. Your spectacle is a non-electric aid. It is just an one-time aid. You just wear it and it just does it function. Until and unless you drop it, you break it, nothing happens to the spectacle. But hearing aid is not like that. The hearing aid has to pick the sound from outside, and when the sound comes, everything comes with the sound. Your speech, the background noise, the traffic signal. With that, any motor will make a sound to any degree. Plus that sound which the amplifier makes, all these sounds has to be uh, present to the ear, and from there it has to it's a complicated system. I mean, from there it has to convert itself into an electrical energy, then it has to turn it into an electrical signal at the nerve and get represented at the brain. So the process itself is highly a complicated process, getting it through the hearing aid. The days have changed, the technologies have changed, the hearing aids have become, there are very good hearing aids. It is costly. I'm not saying hearing aids come with any cheap price tag. They are expensive, but the expectations has to be realistic. You cannot replace a normal hearing system at all. So the brain will, but what we are saying is the brain will again start relearning to accommodate itself. When there is this much noise, the brain will relearn to make sure that the noise is being suppressed and only the speech gets enhanced. So you always need that learning period with hearing aids, unlike your spectacles. You go to a shop, or once the doctor or optometrician prescribes, you just wear spectacles, you're happy. But with hearing aids, that doesn't happen. You will take at least 2 months or 3 months for you to really adjust with the hearing aid. So the system cannot be replaced, but of course, yes, the way you uh, accommodate yourself with the disability or with the hearing impairment is what really matters.
Okay. The next question is from Mr. Keshava Krishna. More senior citizens can't use modern gadgets. If we make them use, will it helpful? Will it be helpful? Because they presume hearing aid is a modern gadget with a lot of technology into it, whether really they'll be able to use it or not.
The hearing aids are very simple. Right now, it is not something which no one can use it. Until and unless it is like with the mobile apps and what those things you have, those are all sophisticated hearing aids. But I don't think so. If someone is not able to use it, don't buy it. There are always an alternate option. It is like you buy an iPhone and you can buy another Samsung phone also. Both does the same function, but it depends on what exactly is your use and what exactly is your requirement. So the advanced technologies in the hearing aids are inbuilt, except I'm saying you except this Bluetooth connectivity, controlling some of the features over the phone. Rest of the features, whatever we speak about signal to noise ratio enhancement or the receiver in the canal, or all those things are inbuilt. So really you don't have to worry about those things. As long as the aid is correcting your hearing loss and you're happy with the hearing aid, you can go for it.
Though that answer was very correct to the question, but I think also, I think I misread the question. What he's trying to ask is, can we make senior citizen use modern gadgets with use of hearing aids? I think that's also
Yeah, yes, that's fantastic. I think they can they can get back to the normal functioning. All modern gadgets, you can connect your phone with your hearing aids, you can use Bluetooth headphones, you can use TV, you can directly stream the TV into your hearing aids. If you're going for meetings, they have an option of they give a loop and where you can without the noise through that loop, what the person is speaking there can, it's like an FM system. Plus that will help you get back to your driving. You can use the phone, any modern gadgets. I mean, once you get the hearing back, I think it's just a matter of time before you start using it.
This is again from Professor Sishankar. I want to ask if should they wash their heads before ABR test? Because you were telling about placing the electrodes on the heads. Should they take care of any prerequisites before coming to ABR testing or objective evaluation?
Yes, sir. As I mentioned earlier, the major or the primary prerequisite is generally if they have a oil on the scalp, then we don't get the impedance, and we generally it's better for them to come having a head bath, preferably a shampoo bath. That is one thing. Second thing, relaxed, not disturbed. So if they sleep well previous night, they're relaxed, but the problem is they will not be able to sleep here. So the prerequisite for us is to come with clean head without oil. That is one of the important prerequisite for us to do any electrophysiological test.
Next is again from Lakshmi, Ms. Lakshmi Prabha. Does tuberculosis drug affect is a autotoxic? I think that's what.
Well, I don't know which family the drug really belongs to or what is the drug which was taken. So I think so. I will not be able to really answer that question.
Next is, will noise exposure advance hearing loss?
Yes, noise exposure without hearing loss is dangerous, and noise exposure with hearing loss is very, very dangerous. And any noise exposure will bring in a temporary threshold shift immediately. I'm not telling a long-standing effect also. If you get exposed for 8 hours and if you test on the 9th hour, your thresholds will come down. That is called temporary threshold shift. And after some 1 day or 2 days, it will come back to normalcy. But a long time exposure will become a permanent damage, or it will bring in a permanent damage to the ear. Having said this, this is more so in people who have hearing impairment. Because the system is already weak, it is easy for the noise to damage the system than the noise to damage a normal system. So definitely a hearing impairment and noise exposure is much more a dangerous combination than normal hearing and noise exposure.
Thank you. You seem to get a lot of queries, Dr. Pradeep. I hope we can go a little more time in answering some more questions because it's quite nice to see the audience asking a lot of questions.
No problem, sir. Please go ahead.
Thank you. The next one is, can drug-induced hearing loss be corrected?
Yeah, as I said earlier, drug-induced hearing loss alone, see, there are two ways of looking at it. Drug-induced hearing loss, generally we say that only the extended high frequency gets affected if it's a pure drug-induced hearing loss. And that can be seen only in older adults or someone who is less than 45 or 50. So drug-induced hearing loss alone will not affect your speech perception to the extent of a combination of drug-induced hearing loss with an age-related hearing loss. So, but if the person has been showing an high frequency hearing loss and it is affecting his normal day-to-day conversation, definitely it can be corrected with a hearing aid. And probably you'll have to go for a slightly higher range of hearing aids where we can program only the high frequencies and we can cut out all the low frequencies. So it can be taken care of. It's not an issue, but definitely it can be corrected.
So you're on mute.
Sir, you're mute.
Very sorry about it. Sorry. I think the question is also about whether there is any treatment options with reference to drug or surgery when there is a drug-induced hearing loss.
No. Once the cochlea is damaged, I don't think so you can do anything with respect to with surgery. There's no possibility.
The next question is so related to that. Is Ayurveda, they prescribe medicines, so will it be helpful in your opinion?
I don't know, sir. I'm not an. What I suggest is I don't tell them don't go for Ayurveda, don't go for homeopathy. It is left to the individual, right? according to the science, which I have believed, which I have learned, a sensory neural hearing loss cannot be corrected. So what I tell all my patients is, you go by what I say is, wear the hearing aid. Then you go to an Ayurvedic doctor, you go to homeopathic doctor, you go to an ENT doctor, you take the treatment, whatever treatment. And any day if your hearing improves, all that you have to do is throw that hearing aid. That's all is what you have to do. So you please go ahead. I will not stop them from going into Ayurveda or homeopathy. That is up to them. But my concern is, if someone says after 6 months your hearing will get corrected, I don't want them to waste that 6 months. So you go for a hearing aid, start using the hearing aid. Any day your hearing comes back, you just throw the hearing aid and you can just walk off. So you can go for treatment. There's nothing wrong, and no one can claim to be better than other person. But my science says you cannot leave the hearing loss for a long time uncorrected or untreated. So take my advice and start using the hearing aid. Any day if that drug has worked for you and you have corrected your hearing loss, just make away with the hearing aids. That's all. As simple as.
Thank you. The next is what is the range of audio you from you? I think what is the the sensory range that is being asked. I think about what is the range from normal to severe. What is the range? Is there any range
Not
when you
clear
call
the
a hearing
question.
loss? I think.
With regard to hearing loss, what is the range that somebody can hear? This is a question from YouTube.
Range, are you asking me in terms of dB? How much dB can they
I
hear?
think the question can be very well asked about when do you call a person has hearing loss?
That was the first thing I told in my slide. If you ask me to do it through all the equipments, probably I have a criteria. Say, for example, if you can't hear a sound which is 25 dB or 30 dB, from there, my diagnosis or my degree of segregating the patients with hearing impairment into category starts: mild, moderate, severe, profound. But even if you have only 20 dB hearing, and if you keep asking what, then probably it is not to do with your hearing as such, but you have a problem with understanding, which also is a type of hearing loss. That's exactly my point here. So hearing loss cannot be considered only on the hearing level. That is what we all have to understand. There are something called central hearing loss where you can hear everything, you cannot understand. There is a clinical population which is called auditory neuropathy people where they can hear and they don't understand. So we'll not get into that. But what you have to remember is hearing loss is not based only on the levels of hearing. Here you can have, someone can have 40 dB hearing loss, I mean 50% according to a normal person's understanding, but he might not benefit with hearing aid. But someone might have 75% hearing loss, he might benefit with hearing aid. The speech perception is what really defines the hearing impairment according to me. But of course, on all books and for all practical purposes, anything above, if you are not able to hear a sound which is of 30 dB, then probably you have a hearing impairment of a milder degree.
Okay, right. Yes. The next question is one of the again from Ms. Lakshmi Prabha. One of the doctors said that the ear nerve is affected and that cannot be managed with hearing aids. I think it is just when they say about elderly people, your nerve gets affected. Is it something related to that, Dr. Padi?
That's what I feel. Probably instead of explaining what is cochlea, what is sensory, that's what they might have meant. Probably telling that your ear nerve has been affected and it cannot be corrected. But I don't understand how they decided it cannot be corrected with hearing aids. So probably did they get into the speech perception course? Did they see the speech perception in noise course? Or if the hearing loss is profound, or she has any other associated illness? Because until and unless we know that history, probably will not be able to comment on this. But according to me, if the patient has retained speech perception ability, the hearing loss can be corrected with hearing aids if fit with appropriate hearing aid.
I think we'll go for another three questions and then I think we can conclude, Dr. Pradeep.
Yes,
The
yes.
next question is, there's a continuous ringing in the ear. Is it curable?
Well, again, tinnitus or the ringing, what you say, it depends on what has caused it. Now, central tinnitus is very difficult to cure. And if the tinnitus is because of any external ear or middle ear infection, it is curable. Again, that's something which an ENT doctor has to take care. As an audiologist, I will not be able to tell you about the treatment options available. But if it is central and if it is not related to any infection or any blocking or any cold or anything, then most of 90% of the time it is not treatable. Having said this, if the tinnitus is with your hearing loss, then your hearing loss correction might reduce the intensity of the tinnitus. I'm not telling it will disappear, but it will reduce the intensity to a greater degree where uh, probably you will forget the hearing, you will forget the tinnitus.
Two related questions. One is by Mr. Keshava Krishna, and second is from Ms. Pushparani. First question is, does wearing hearing aid have any side effects? The other question is, by if hearing aid is not used, whether hearing would decline by age.
Okay, can you repeat the first question, sir?
First question is, does wearing a hearing aid has any side effects?
No. Wearing your hearing aid has no side effects. Rest be assured, we can give you 100% assurance on this. There is no side effects on wearing an hearing aid, as long as, this is my tagline, as long as you have been evaluated by an audiologist, your thresholds have been properly established, and the particular hearing aid which you are using is deemed to suit your degree of hearing loss. If you have a mild degree and if you fit the patient with a profound category hearing aid, definitely it has side effects. And what are the side effects? You will start losing the hearing. Rather than benefiting, you'll start losing the hearing. It is like a normal person going and keeping his ears in front of a loudspeaker in the marriage hall, if you are fit with a wrong hearing aid. So if you are fit with a proper hearing aid after proper evaluation, there is no way that there are any side effects. The second question was?
The interesting question is, even with the use of hearing aids, does hearing decline by age?
Yes, use of hearing aids has nothing to do with stopping the declining of hearing loss, but it will reduce the rate of deterioration. For example, there are two things which you have to understand. One, you have 45 dB here, 45% hearing loss today, and after 3 years, it might become 60% if you don't use a hearing aid. But if you use a hearing aid, that 45 might just stand at 50 or 52. It will not go to 65. This is one. Second thing is, or the most important thing, if you don't want to consider the deterioration, when you fit the hearing aid today, whatever benefit you will derive today will not be the same benefit you will derive after 3 years, even if there is no deterioration. That's the major point which we always try to focus and which we always tell people, please understand, even if they say, sir, my hearing has been like this for past 5 years, fine. But had you fit yourself with a hearing aid 5 years back, you would have benefited much more. But today, if you fit, you will benefit only 80%. And again, 5 years down the line, you will benefit only 30% or 35%. So that is the difference. And if someone says, if you don't wear hearing aid, you will become profound, that's also lie. And by wearing hearing aid, if someone says your hearing is not going to deteriorate, that is also lie. The focus here is, how much do you benefit from the hearing aid if you fit today and if you fit 5 years down the line, and rate of deterioration. These are the only two factors which will come into picture.
The last two questions, Dr. Pradeep. First question was, does hearing loss, impairment, deafness are all similar?
Pardon, sir, I didn't get you.
Is hearing loss or impairment or deafness are all similar terms which can be interchangeably used?
Hearing loss, hearing impairment is interchangeably used. Deafness or deaf is something which is not used now. I mean, as for the classifications, deaf is something which we are asked to avoid to use, and which was used for generally congenital hearing impairment. Otherwise, hearing loss and hearing impairment has been used interchangeably.
So there are many more questions. I think by the want of time, we may not be able to answer everything, but quite while they can get those clarifications by writing to us, the organizers. The last question is a very deemingly fit question. How to safeguard yourself from hearing loss? I think that can give a concluding remarks too.
Safeguarding yourself from hearing loss, well, there are multiple factors starting from your the habits, but age related hearing loss, I do not really say there is something which we can safeguard. I mean, if it has to happen, it will happen. Again, it depends on your health conditions like hypertension, diabetes, or if you're taking any cardiac medicines, and all those issues are something which are factors which would induce hearing loss. That is one. stopping an age-related hearing loss, I don't think so it is really possible. But in adults, yes, of course, our habits of excessive using of headphones, using earphones, using Bluetooth phones, using at maximum volume, continuous noise exposure, uh, smoking, drinking, everything has an impact. So you have to stop all those things to prevent, that's all.
Thank you. Thanks a lot, Dr. Pradeep. It was very informative, very interesting, and very interactive. And thank you for all that you have given us. Thank you.
Thank you.
A special thanks to Dr. Pradeep sir for making this very brief and informative presentation, sir. And sincere thanks to Dr. Arvind sir, who's moderated the session today. There was quite a long list of questions. We've tried to cover maximum in today's session, but do stay in touch with us. We are going to have a series of webinars on the lines of hearing and audiology. So we've taken note of the questions and we will be addressing this in the future. If you have any specific questions that you would like to be addressed in detail, please write to us at vms.nimhans@gmail.com. I've put the email address in the chat box. We'll get back to you with further information. Also, we'll keep having webinars every Monday, so stay in tune with us. So we'll keep having more sessions with you, sir.
Sure.
It's a pleasure to have both of you on our board, sir. Thank you so much.